So quickly on the next, we are looking at the introduction to acute kidney injury, and this will actually serve as our first, this will serve as our first lecture towards us discussing acute kidney injuries in children. So for what we have here, we introduce it, but I want us to actually just define terminologies, as this is an introductory class. When you say something is acute, that means you mean to say there's an issue happening, and that issue is happening very quick. Kidneys is the kidneys, right, in our bodies. Okay, then injury is injury. All right, so in children, you're just trying to say, yes, acute kidney injury could actually occur in adults. Okay, but this one you are looking at specifically the children because they're kind of like a special population. So for acute kidney injury in children, we said that it's a sudden decline. That's why I told you guys that anything acute is happening all of a sudden. So there's a sudden decline in kidney function, and this is kind of like scattering how the body should normally maintain fluid, maintain electrolytes, maintain waste. Okay, so it's a serious condition that can range from mild to high level complications. Okay, and it often occurs in hospitalized or critically ill children. Okay, so a child could develop this in hospital, that's hospital acquired, or they could actually come with this from their homes, that's community acquired. So what is acute kidney injury, to be specific? There's a rapid rise in serum creatinine, so the kidneys are not being able to keep up with putting out waste, a reduction in urine output, okay, and there's a decline in glomerular filtration rates. So this will ultimately lead to what? A backup of what? Waste products in the body, because the kidneys are not being able to put the waste product out efficiently. So there's accumulation of nitrogenous waste, the electrolytes are not balanced again, fluid is overloaded in the body, and there's a whole lot of acid-base disturbances. So for children specific issues, okay, issues you try to pick up that are making the child uncomfortable include weakness, swellings in the extremities, the way they are producing urine is declined, their body pressure and their blood pressures are going up. So what could actually cause those issues include prerenal issues. That's like you have an issue occurring before the kidney. It could be renal issues. You have an issue occurring inside the kidneys. It could be what? Postrenal issues. That's you have an issue occurring after the kidney. That's after urine is produced within the kidney. For the urine to be put out of the body, you have issues there. Okay, so epidemiology and impact. So in children, their kidneys are still developing, so they are much more susceptible to complications. Do you understand? So this could cause death, this could cause a lot of things. All right, it could also lead to chronic kidney injuries. Okay, so diagnosis is just based on a KDIGO criteria. So you are looking at the creatinines. If it is going above 0.3 milligrams per dl, okay, or if it is increasing more or equal to 1.5 baseline within 7 days, if urine output is less, okay, and all of that. So why early recognition matters? Okay, you want to recognize it early because you want to prevent, you want to pick it up early, you want to start treatment early, so that of course you should prevent all those complications that should actually come up with this.